Greetings.
Hi, Dr. Lister. How are you?
Hello, I'm great.
Thank you so much for joining us today. We've had a great day so far with different podiatrists and different panels, and I just want to thank you for your time, first of all, to join us. And yeah, we're going to get started with our session. But first, can I ask each of you to just give a quick introduction of who you are, where you're based, a little bit about your journey? I guess we can start with Dr. Dutra.
Well, hi, greetings, everybody. This is an exciting time, so thank you for inviting me. I'm currently an assistant professor at the podiatric, let's see, what's it called now? A College of Podiatric Medicine at Samuel Merritt University in Oakland. I've been full-time there about 14 years. I come from a private practice background. I was in solo practice for over 20 years in San Leandro, which is in the East Bay. Also have worked pool work for Kaiser. I've done student health center work at Cal State University East Bay, as well as UC Berkeley Tang Center. Have a sports medicine background, which we can talk about a little later. Also covering the UC Berkeley athletic teams. We currently have 30 different sports, 15 women, 15 men, and formerly was with the Warriors way back. Yeah, and so I'm excited to be here, and I am definitely with the sports medicine background. Thank you.
Great. And Dr. Lister.
Hi, everyone. I'm Dr. Lister. I am based in Sacramento, so go Kings. I started out my journey just shadowing a few podiatrists in the area. Got very interested and had a few good experiences. So I ended up going to Western University Health Sciences a few years after they had opened, and then did my 4 years there. Came over to VA Palo Alto for residency. And then I worked my way back to Sacramento. So I finished residency in 2020. I joined a private practice out here, and I had been there for 2 years. And then I just recently joined with Sutter Medical Group out here. So at the end of January, I started working with them. And so that's kind of what I'm doing right now. Pretty straightforward, but yeah, I enjoy it, and that's where I'm at right now.
Great. Thank you so much. Oh, I feel like I have feedback. Let's see. Does anyone have like any other devices? Okay. Dr. Ivanova, could you give a little introduction, please?
Sure. Hi, I'm Varsha Ivanova. I grew up in Canada, hi, Dr. Dutra, finished high school in the Bay Area. I went to UC Davis for undergrad, and I was actually quite involved in the, go Aggies, and I was quite involved in the pre-med conference, organizing that. So it's really great to be back as a speaker now. I actually shadowed a podiatrist after I graduated college, did not know anything about podiatry. I worked there in her office, and I was an office manager, so I got to know podiatry quite intimately. I ended up going to Samuel Merritt University for school, and now I'm the current chief resident at Kaiser Santa Clara. Our residency will kind of go into detail. It's about 3 years, so I'm graduating this year, and I'll be joining a private practice in the Bay Area.
Congratulations. That sounds great. I guess I wanted to start, and if any participants have any questions, you can put them in the chat. But I just wanted to start off very simply, like what inspired you all to join? I know Dr. Lister, you talked a little bit about shadowing, but what kind of introduced you to the field of podiatry? We could start with Dr. Dutra.
Yeah, I'll keep it very brief because I think that's a very interesting question, in that most of us are pursuing some medical or healthcare career. So basically for me, I grew up playing sports, loved sports, and I always wanted to be a doctor. So I always wanted to meld the two and go into a sports medicine profession. And so that's kind of what appealed to me. When I was an athlete, I had a lot of different injuries. I was an athletic trainer during graduate school, and I was in kinesiology and sports medicine. So I got to be around a lot of athletes. And I said, wow, this is really, really interesting, because about 2/3 of all our injuries were foot and ankle injuries. So definitely I started saying, wow, podiatry might be a great profession for this. Plus it's a surgical specialty, which is what I wanted. So I think that is the main thing that attracted to me. Also, that it's a relatively small profession, so the outlook's usually pretty good as far as being able to have a good career. And really what attracted me most is the career pathways that we have available. During my time coming out of school, solo practice is probably the most common thing, but there's so many things you can do. Even while I was in solo practice, I still did other things, student health center, different, you can do a lot of different things along the way while you're in practice. And that attracted me. To be a consultant with teams was attractive. So that's kind of in general. Plus I liked where we had a focused curriculum. So we were going into our podiatric and clinical sciences. Third year, fourth year was all clinical, and then we were doing our residency. So to me, that really appealed to me, that we already knew what we were going into, and we knew that we were going to get a surgical residency because we knew we were going to go into podiatry because we're in podiatry. So anyway, that's kind of a nutshell. I do want to say, when I was at Davis, I did have the opportunity to shadow a lot of different health professionals and doctors. And I think that's extremely important, because you really want to see if it's really right for you. And the reason I knew it was right for me is, again, all age groups, we go from basically cradle to grave. You basically see, wound care, podopeds, sports medicine, trauma surgery, elective surgery. So just a huge variety of opportunities in your practice. And also we're part of the medical team, which I think is very important. So that was in a nutshell. Thank you.
I guess I'll go now. What got me into podiatry? So I met the first podiatrist when I was a senior, or my fourth year of college. It was my roommate's dad. He was a podiatrist over in Southern California, and I knew I wanted to go into medicine. I was not interested in podiatry at all. He asked me if I wanted to shadow him, and I said no, because I don't want to touch feet. But he was a really great guy, really nice, amazing guy. And so, it was kind of in the back of my mind at that point. And then I ended up coming back to Sacramento. I actually, got involved after I graduated and took a few more pre-med courses, and got involved in like the UC Davis pre-conference and all of that other undergrad stuff, right? And I met another podiatrist actually at Sutter, because I had an ingrown toenail. And he was a really good guy, really nice. He had actually just finished residency over in Kaiser in Sacramento. And he had just started out working with Sutter. And again, he was amazing. And he basically, he didn't force me to become a podiatrist, but he pretty much was like, do you want to be a podiatrist? And I was like, no. And he was like, well, hey, just shadow me, come to the OR with me. Like, we can do a bunch of things. And he was just a really nice guy. And I was like, I think I actually do like this. And in the back of my head, I always wanted to go into anesthesia. So I started shadowing a few anesthesiologists and a few other specialties. And I just didn't really care for it as much as I thought I would. So then I really just committed to podiatry. It took me probably about a year to actually commit, because again, as you guys may or may not know, for the participants, you commit to podiatry as soon as you come in. And that was a little bit challenging for me, knowing that if I didn't like it, the next 7 years of my life would be committed to podiatry. But I ended up taking the leap, and it was pretty much amazing from there. I actually met my really two great close friends in school. I met a lot of great people. Obviously it's challenging, but between that and in residency, I still talk to all my co-residents pretty much weekly. And even now, so full circle moment. So the Sutter Medical Group I work for, I work with the podiatrist who actually treated my ingrown toenail. So it's really amazing. It's a small community of people who really want you to succeed. I've never truly met a podiatrist where I was like, oh, like you're a jerk or I don't know. I just got bad vibes from them. And so it's really been a really good experience for me. Again, I'm only 3 years out of residency, but you know, meeting all the people that I've met, all of the experiences through the past, you know, decade, I guess now, it's been really good, and it's a really good field to be in. So that was kind of how I got into it. So
I'll go next. Mine's, I guess, more of a personal story. About 15 years ago, my father was in a really bad motorcycle accident and had an open fracture in the middle of the highway. He was admitted to the hospital for about 3 weeks. He's doing well now, but as a result of the injury, he wasn't able to dorsiflex or move his ankle up and down. He had drop foot, if you know what that is. So after that, he kind of went to his podiatrist and they worked on bracing for him and, you know, kind of got him to start walking again normally. And that is actually the podiatrist who I ended up shadowing and working for. So as I went through my work and as I went through school, I kind of saw how impactful the career could be in a person's life to get them to start walking again, whether that's sports medicine injuries, diabetic wounds, or in-office procedures. I just know how impactful it is. And I thought that was a really great avenue for me to go down and make a big difference in somebody's life.
Yeah, sometimes it's like the personal experiences that really kind of show you where you should go in life and inspire you. So yeah, we have a couple of questions in the chat. Is my internet okay? If shadowing is important, and how can you find a doctor to shadow? Did you hear that?
Yep.
Okay.
You want me to start? You want me to start?
Yeah.
I'll start.
Yeah, Dr.
Okay, so shadowing is, of course, the most important thing you can do when you're pursuing a career choice. And basically, the best way to shadow is to find a local podiatrist in your community area. But for instance, also if you're an alumni, being a Aggie alumni from Davis, it was very easy to find alumni podiatrists to shadow, which was, I think, really, really valuable. And the thing that I think a little more unique for the generation now is that it's shifted a little. When I was coming out, it was mainly private practice, solo practices. Now you're getting more into group practices and other opportunities, you know, VA, Kaiser, Indian Health, that kind of thing. So I think personally it's good to try to do several different offices and spend enough time there that you feel comfortable, and also talk with the office staff a little bit if you can, and then definitely if you have the opportunity with the patients, because like most of us, when I did my shadowing experience, even though it was many years ago, it was still very similar in that the patients on the whole just loved their doctor because they were actually leaving feeling better than when they came in. Also, it tends to be, most of the podiatrists tend to be a little more personable, I think, because we're used to talking with our patients more. So I think that the lifestyle approach, the life balance, I think was really important. And I think all the different other opportunities that you could do along with your practice, which was, I think, a great opportunity. You can go teach, you can go volunteer in clinics, you can go do different things at the same time. So when you shadow, I think that's extremely important. Make sure that it's positive. If the podiatrist or whatever doctor you're checking out with isn't really gung-ho about it, I don't know if I would go shadow with that person. You want to have a positive experience. I think someone who is comfortable having a pre-med student come in and talk with them. So yeah, I think that's really important. And also, it's interesting because if you're doing that in your hometown area, down the line, it's a great networking opportunity for you. So when you come back in the area, or you want to talk to someone in your hometown area, for instance, you already have some networking going on. So anyway, I think that's very, very important. And even though the schools require shadowing, you should be doing that anyway. And you should shadow the other interesting thing was with surgery. Now, back then, I could go into the hospital with them. I could go in the surgery center with them. You can watch it in the office. So also, I think seeing the different settings that you can work is also very important. And then if they happen to go to a free clinic or somewhere where they're volunteering, I think that's really exceptional. So I think, does that answer most of the question on shadowing? Thanks.
I completely agree, Dr. Dutra. As a student, as a pre-med student, and as a resident, when I've been trying to reach out to any podiatrist in the area, I've never been told no. So I definitely encourage going to visit multiple different practices just to see the field in different ways.
I would add to that. Well, I completely agree with both of you guys as well. But I would add to that, if you get a chance, try to shadow a different field too, because you'll start to see the differences of being in podiatry versus, maybe an ortho group or family medicine or emergency medicine. And you'll kind of see kind of what we talk about with podiatry in the sense of you can do a whole lot with it because we all kind of encompass those things and you can taper your practice to that. So I just recommend you shadow podiatrists as well as other specialties.
Yeah, I think that's really good to add. Someone asks, what is the best moment or experience with your patients? Can you share a story, please? So that's one part of the question. So what's your favorite kind of memory or experience? And then the second part of the question is, how do you manage your mind after work, especially if there's something that was kind of traumatic that you saw at work, such as a death or a really bad injuries?
Well, I think
Dr. Lister, would you like to start? Okay.
Yeah, I'll start. Yeah, that's fine. Yeah, unless Dr. Dutra wants to go, I mean, I can start or whatever. Okay. I'll answer backwards. Okay, so how do I ease my mind after work? Previously, I would just really kind of do things that I knew would kind of that I like to do, right? So before I would go to the gym, right? Or I would talk with my friends or decompress with whoever. And again, I think that's the importance of having, a good support system because like I could talk to my family or my wife about a patient or a situation, but they wouldn't really understand. Whereas like I have a group text again with my two really good friends and we literally text every day and we were roommates in podiatry school. So I think like I'll reach out to them, right? And they'll kind of, help me decompress when it comes to those types of things previously. Now I have a baby she's 8 months. So I think more so than anything, I just, as you get into the field, you kind of, how do I say it? I know my daughter needs me, and I know I've gotten better at, separating the two, right? Like I come home, I don't have that much time with my child or my wife, so I'm able to kind of decompress on my way home and kind of handle it that way. But it's definitely good to have a good support system. And then when it comes to patients, I would say best moment experience, honestly, it's a very regular thing because honestly patients come to you for the most part and they have an issue, right? Like whether a patient comes to me and they're like, I have ingrown toenail or I'm 80 and I'm a diabetic and no one can trim my toenails and my toenails are busting out of my shoes, like you literally are like either helping them right then and there or you're helping them a little bit down the line. So, I mean, gosh, some days I'm full of doing nail trimmings and all of my patients are like, oh my gosh, I'm so thankful that you're here. Like, I feel so much better. I'm going into the weekend. And it's as simple as it sounds because we can all kind of do those things ourselves. So right now, I guess we get older, you become less mobile and you're unable to do that stuff. And people really appreciate it, to be honest with you. They do. So I would probably say that. I think on a regular basis, I really do have appreciative patients. And it reminds me of why I do what I do. So
Yeah, Dr. Dutra, you can go ahead.
Okay, those were great answers, by the way, and I would kind of agree. I think it's hard to pick out one particular favorite incidents, but two areas I'm going to go over is the sports medicine realm. It's very rewarding to be treating an athlete. So, for instance, at Cal, if we have an athlete coming in, we're treating them for, let's say, heel pain, shin splints, knee pain, whatever. It's really rewarding to actually not only see them progress, but then we go to the games and watch them play. And I think in sports medicine, it's not only them recovering from the injury, but recovering at the level they were previous. And so that's very rewarding to see them be able to go back and compete without fear, hopefully, of re-injury or furthering a unrehabilitated injury. So I think in that aspect, and of course, college athletics is very interesting because it's basically still very passionate. They're not doing that for money, so it's something they really love to do. So I think keeping them moving is really rewarding. And then the other area is actually wound care. I've done a lot of wound care in my years of practice, and it's very rewarding to salvage limbs basically and see them heal up. And our goal when we heal up the wound is obviously that it doesn't reoccur, and that we keep them active. So the bottom line is, I think what's rewarding during our practices is we keep everyone moving. We're very outpatient oriented. So anyway, that's kind of that first part. The other thing is, I think the important thing in our profession is our life balance. So I've always made it a point, spend time with your family. I did a lot of youth coaching, pretty much all kinds of sports throughout my career, and I love doing it. And it's funny because it was kind of involved with our profession in many ways, but it was a nice outlet for me. So I think that's one of the big benefits of podiatry is the life balance, gives us a lot of opportunities. And as I would tell any student who is considering our profession is, you're all very unique. Remember your talents and don't get away from that. You have different passions, and I think you want to keep that going in your life. So it's important to have that support system, but also make sure that you, live your life, and don't let podiatry define your life. Does that make sense? So you shouldn't let your profession define your life, but it should complement what you do. The other thing I just wanted to add, one of the things I liked about private practice is I was very community oriented. So you can become involved in your community, not just in your practice, but I was very involved in the Chamber of Commerce, the Kiwanis Club, the Special Olympics, different things you can do in the area. And I think that's another thing is your profession will give you many pathways to other things you can do in the community, which I think is very helpful for us because it really lets the public and the community know who are podiatrists, what do they do, but they also are more than just a profession. They also are involved in their community. So that's what I would say too.
And a couple other areas that have been really rewarding. I totally agree with Dr. Lister. It happens so often, I can't really pick a favorite moment with a patient. But one of them is certainly when patients come in to the emergency department with a completely dislocated ankle. You have the opportunity to put it back into position. I then follow them in the operating room, do their case, see them post-operatively, and it's really rewarding seeing them in such a vulnerable position and then watch them walk all over again. So that part is definitely really rewarding. And then the second one, similar to the wound care example, I think there's some patients that don't quite understand how severe diabetes can be, and people sometimes are very visual. So when I explain to them their wound and how their diabetes impacts their wound, I think I can see their brains kind of clicking and how they can understand how important it is to control their diabetes, for example. That is another really rewarding place where I can educate a patient and give them visual examples.
Yeah, I think that actually what your disease is, because words can be quite difficult to understand if it's like a lot of medical terms. We have another question in the chat. As a podiatrist, how do you treat a patient with multiple comorbidities? How do you consider possible drug interactions with pre-existing medication that the patient takes when prescribing new treatments? Do you want to start with that, Dr. Ivanova?
Sure, it's a very specific question. So, I mean, during school, we do learn about pathology, pharmacology, so we definitely have knowledge in that, but it's not something that we are forced to do on our own. We are definitely collaborating with other medical specialties. So depending on the type of practice you have, especially in a hospital-based setting, you are able to communicate with these other physicians and discuss those kind of medical issues. There are things that we manage, for example, infections, and musculoskeletal injuries, but things that we don't manage that are managed by internal medicine, for example. So there are other specialties overall that we can work with to manage a patient's comorbidities.
I will piggyback on Dr. Ivanova. Yes, that's exactly what we do. I think that, podiatry in itself, you're a specialist and, you use other resources to kind of sort of figure out what your patients need, what your patient needs. You reach out to, infectious disease specialists, you talk with their primary care physicians. It really is a group approach for patients with multiple comorbidities who, are diabetic, end-stage renal disease, all of these things that you'll experience. But also too, throughout your process of becoming a podiatrist, you learn how to deal with these things, right? Like you spend 4 years in school training really hard, and then you spend 3 more years in residency training really hard. So you get the experiences, right? Like yesterday I was on UpToDate looking up things for patient, right? Like how to maneuver through the system. And then you also rely on resources. And then again, I've never met a podiatrist who was unwilling to help me out. So again, I have partners who I work with in the office, and I walk down the hall and ask them questions. So it's not fearful anymore because again, you're trained well, and you have resources. And realistically, I've never met another specialist or another physician who didn't really appreciate what we did. So there was always an open door kind of policy when it came to that type of stuff.
Yeah, I just wanted to add something really quick. Like, even though when you start podiatry school, you are already going to be specialized in podiatry, you still learn all the other body organ systems. Like you still learn the full anatomy, full pathology, pharmacology. So you still learn like everything that MD or DO school would also learn, just a little bit more related to podiatry when you're learning about different drugs and stuff like that. And you do a little bit more of lower extremity anatomy as well, especially in the first 2 years. So just wanted to add that as well. Dr. Dutra, did you want to add anything to that, or?
Sure. I would totally agree with everything that's been said. As we tell our students, you're treating the patient, not their foot. So there's a lot of comorbidities and things that go hand in hand with that. And also we're very public health oriented. So much of what we do is preventative and educational. I think also being aware of the medications your patients are on, the specific interactions, what they're specifically for. And then lastly, I just want to throw in, one of the things I think that as podiatrists, we need to be doing is exercise prescription for all our patients. So all our patients are athletes of their own right. And even if they're a diabetic with a foot ulcer going through treatment, we still have to come up with activity designed specifically for them to keep them in good shape. So I just want to throw that out, that I think even though we are specialized, we do get general medicine. We do rotate through on all of the different discipline rotations during our residency and that. And so we do have to know a lot about the whole body in general. So yeah, but good point. So I think that was well covered.
Yeah, someone asked, is it common, and this might be for Dr. Dutra or anybody, is it common for professional sports teams to hire podiatrists?
Oh, yeah, I could go with that. So professional sports teams, as far as I know, in this day and age, all have specifically team podiatric physicians on their staff, and they aren't necessarily always looking for one because they'll find the ones that are qualified usually. So the one thing I would say is if you are interested in becoming a either professional or even a collegiate podiatrist for respective teams, look at your training, because for you to be a good applicant for their position, you need to have a sports medicine background. You should be involved in the American Academy of Podiatric Sports Med, American College of Sports Med. There's fellowships you can do. There's board certification. So if that's the route you're going, it's very hard to become a professional team podiatrist straight out of school, because you have to have some training and some experience under your belt. It is changing. The collegiate sports probably offer a lot more positions because there's so many more collegiate teams and divisions, 1, 2, and 3. So the thing that I prefer with collegiate sports is you can do a variety of sports. So for instance, I'm fortunate at Cal to be able to deal with 30 different teams, where some people will just take one team. That's okay, but then that's very limited. And then just lastly, if you are interested in being a professional team podiatrist, that's not really your only job. Usually you have some kind of practice, and that's more of a consultation job where you'll come and cover for them. Obviously, if you take basketball, there's at any time maybe 12 to 14 players on a team, and maybe only a few of them will have foot and ankle injuries, whereas at Cal, we have over 1,000 student athletes. So you're always going to have people. So again, it's going to be dependent on your daytime job or what you're doing on the side as well. So usually the consultant thing is just that. It's covering for the team. They always have a head team physician who will triage, and they usually have athletic trainers for each sport. So that was in a nutshell. Good question.
Yeah, that's great. Did you want to add anything, Dr. Lister or Dr. Ivanova? Okay. My next question is, people were asking, what would you do differently if you were to start your podiatric journey? What would you do differently?
That's a good question. What would I do differently? Probably, maybe I think I took 2 years off, so I might have taken 1 year off instead. Yeah, that's probably honestly the only thing that I would change. I think that like going into podiatry school and going through the process, I thought one thing, and it was different, but I think that the journey is, I mean, a part of the experience, right? Like, I think that like I can't say I would do anything different. But I know that like my journey, I guess it was just you accept the journey and you enjoy it and you kind of go from there. Like, for example, right? So when I was in podiatry school, I knew I wanted to come back to Northern California, right? And when I was a second year, I shadowed residency programs, and I actually shadowed Kaiser Santa Clara. I did VA Palo Alto, and I did Kaiser Vallejo. And I remember by the time I remember specifically thinking, I was like, okay, I want to go to Kaiser Santa Clara. Like I do. I remember that specifically, right? By the time I got to my 4th year, and I externed at all of the locations, but I think by the time I got to my 4th year, like I just didn't think it was for me. Like I thoroughly enjoyed it. And I mean, oh my gosh, like they're extremely well trained, Dr. Ivanova, right? But it just wasn't my thing, right? And I had a better experience for me personally at VA Palo Alto. And I went through it and I don't have any regrets. I mean, I know maybe I would practice a little bit different. I don't know. But I enjoy where I am, right? Like, and I think we all kind of go through that whole kind of experience with podiatry. Like, I don't think I would change anything different. I think my path might have led me down a different pathway, I guess, right? Like if I were in a residency in Kentucky, my life may be a little bit different, right? But I don't know anyone who really has any regrets when it comes to that type of stuff. So yeah, there's my answer.
I totally agree. I took a couple years off as well. And I was thinking maybe if I just took 1 year off, but I think that extra year, you do still learn a lot of life skills. I worked, like I said, so I think having an extra year before starting school is really, really valuable. And Yeah, I don't think I would change anything.
Yeah, I would agree, I think, with that, in that I had a week off between finishing up my master's thesis and starting podiatry school. And that I would have appreciated having a gap year to at least be doing some other things. So I started podiatry school pretty much, I don't want to say burned out, but, pretty much having already gone through a postgraduate program. I will say, though, I felt well prepared in that I knew what I wanted to do. I knew I wanted to do a podiatric sports medicine fellowship right after my residency. So I was pretty well, prepared that way. And I knew that private practice, I knew I had the personality for it, because I think that's obviously a challenge going into private practice with being a small business and really promoting yourself and doing all that versus going into more of a group situation. So I think a gap year would be nice. And I think just try to be as prepared as you can if you're thinking about going into one of what we call our subspecialty areas, because obviously when you apply to your medical staffs, it really helps having a fellowship or some other postgraduate training if that's an area in your community that you're going to showcase as your specialty. So just to throw that in, but I think the gap year is good. And when we interview our students, we not only look at the gap year, but what did you do in that gap year? Was it something where you at least were in the healthcare field, or are you doing something for professional development or something unique? But even if you're going to travel, there's nothing wrong with that too. So, I think that's a unique situation, but I think the way it is now, having a gap year would probably be recommended, just so you're ready to go and also financially prepared, because it is quite a commitment. And I'm sure you've talked about that today, but the financial commitment is, that's the other thing, is I know it's, continuing to go up and up and up, spiral up. So the cost of our education is tremendous. And so be prepared for that. So on that good note, I think, but great points, great points.
Thank you. Another question, kind of toward Dr. Lister. What was it like going to school, especially as a person of color, and especially being Black in your medical school? Like, did you experience any racism, or tell us a little bit about your experience and how it was like?
Good question. Did I experience any racism? Nothing overt. Probably because I've spent so much time in California, and it's a pretty liberal or state, and I think people are pretty welcoming. I think for me, I've known I wanted to be a doctor probably since I was like 5 years old. And I think as I started, taking, even from high school moving forward, I think that a lot of the courses I took, I didn't see a lot of people like me. So I think I was kind of sort of used to it by the time I got to podiatry school. I think, at least for me, like I've always kind of been aware of my race and experiences as a Black male in this country. And I haven't really had too many experiences in the sense of like, the overt racism. But I guess I don't know. I take it with a grain of salt. And then I guess I kind of take it as a challenge too, right? Like I think that like we all in our own respective places in this country, like we know that there are preconceived notions about us, and people may have certain expectations, but I guess I've always just used that as a challenge. I will say, I think I had one scary moment, but it wasn't even racist. It had anything to do with like my patients' experiences, anything like that. But when I turned 18, I remember, or 19, I'm sorry, I got a tattoo, right? I got a tattoo on my forearm. And I remember my mom, like, and she's great, I love her to death, but I remember her being so upset with me, and she was just like, you want to be a doctor, but you're a Black man in America, and you have this tattoo, and then kind of how are you going to navigate through this? And I remember feeling like, okay, I kind of feel like you're right, but at the same time, like I kind of like I'm up for this challenge kind of thing. Like I don't want to stop being who I am for anyone, to be honest. And surprisingly, like I think maybe a handful of people have asked me about it, but I don't think it had anything to really do with my color, my skin color. I just think that ultimately, like you kind of, I mean, as a physician, you know, you're a lot smarter than just medicine, right? Like you understand kind of how the world works. And I think if you're aware of that, you'll be fine. And I think you just kind of remember and use your, you know, knowledge outside of podiatry in medicine to kind of navigate through. And, you know, there are bad experiences, I guess some people have, but you know, I can't say I've really experienced that too much. So.
Thank you. And also for Dr. Ivanova, as a woman in medicine and also a person of color, what was your experience like, and have you been able to like advocate for yourself?
Yeah, I haven't noticed anything, to be honest. I think there are times if you're not very confident, people in the hospital may not take you as seriously. And I think that goes for really anybody, especially interns. So I think really practicing working on confidence, the way you speak, carrying yourself well. I have been, you know, doing that since school and during residency, and I've never been doubted by any patients or anything.
Okay, great. We have another question in the chat. What are some manual dexterity skills that students can use to get a feel of what surgery is like? And what are other lifelong skills that are valuable and can be helpful for students entering the field of podiatry? I guess, Dr. Dutra, do you want to add to that? Or...
Sure. Of course, sports in general, I think are very helpful, depending on the sport, of course. If you're just running, it's not going to be quite as manual for you. But for instance, I played baseball, tennis, that kind of thing, and found that really helped. The other thing is, I think playing such guitar or piano is also good because you're working your fingers. The one thing you have to remember is we're all, I say most of us are a single hand dominant, and it's really good to be as ambidextrous as you can, almost said amphibious, but ambidextrous as you can. And I think that's really important because your suturing skills, and of course, if you do crochet and knitting, that's great too. So I mean, anything you're doing, I think for your fingers is extremely important. And one of the things I've always thought that we should do as one of our pre-admission during our interview is some kind of skills test where they have to mold or do something with their hands. I find that when I'm teaching our biomechanics skills class with casting and taping and that kind of thing, we really encourage our students to use both their hands and start getting comfortable, because obviously when you're in the OR, especially as a resident, and you're assisting and you're learning to use that non-dominant hand for cutting and tying, all kinds of other things. So I think you can never get enough of that. So you need to have strong fingers. And I think any of your hobbies and things you do is only going to help that. Now, that being said, once you are a podiatrist, you have to be very careful of protecting your hands. And so depending on what your hobbies are and your sports, be very careful, because it's a little different when your livelihood depends on your hands and your manual dexterity. But great question.
Dr. Lister, do you want to add to that?
I would say, honestly, really anything you do, like working with your hands, right? So one of my roommates, he was really handy guy. Like he would, always change his oil, and he's changed the transmission and done all of these things, right? And I felt like once we started, becoming externs, or, spending our third and fourth year with patients, like I think he kind of picked it up pretty quickly. Whereas I wasn't doing a lot of those things. And again, I caught up, obviously, but, I think that most of my friends who were, real handy and kind of worked on those types of things, I think that they probably had a leg up on me, to be honest. But again, not to say that I didn't get there. I just remember, like, ultimately, like now I do those things when I have a home and stuff like that. But like, even like, using screws at home and putting, paintings on the wall and being able to screw and hammer and all those things, when you're doing things like trauma or ankle fractures and stuff like that, like you have to know how to drill and use screws and all of these things. So I would say that is probably the thing that I wish I probably did a little bit more of. But again, I don't think it was really I was at any real disadvantage, or I don't feel like I'm at any disadvantage today. So
Yeah, I totally agree. I think sometimes our work can become a little bit laborious, standing in the operating room or sometimes even in clinic. So if you know, if you want to work on running or weightlifting, sometimes reducing an ankle can be a little challenging. So I think a lot of our residents end up becoming very buff in their third year, just being at work.
Yeah, and then we have some students here that are going to community college and hoping to transfer. What could someone, either in community college or regular university, do to best prepare themselves for the world of podiatry?
I can definitely answer this question. So I probably should have mentioned earlier, I went to community college before I started Davis. I didn't know honestly anything about podiatry, or yeah, I knew I wanted to be a pre-med. So I think I was just kind of working towards transferring. I don't think there's anything specific that needs to be that I wish that I did during community college. I think just college on its own can be really overwhelming. So I would just focus on finishing your courses, doing really well. And if there's any opportunity to do extracurriculars, definitely take advantage.
I would totally agree with that. I think so I ended up going to community college, then I transferred to my 4 year, and I actually ended up going back to community college just to finish up some courses because it was just too expensive. But I think, yeah, I would probably try to get involved a little bit more in the sense of in things that you want to be involved in, right? Like if you want to go into medicine, you probably should be involved in some sort of pre-medical kind of experience. But also, like, make sure that you do things that you like, and you can always kind of show if your goal is to become a physician, like people take those things into consideration, like you don't have to spend your undivided attention into making your application look like you are a perfect candidate for medicine. You just have to show that you're committed and interested in things that you like, right? So if you are into ballet or other things or whatever, like like you can be a part of those types of experiences. So I wouldn't say limit yourself, but also it's a fine line of you don't want to be a part of one free medical group but never shadow anyone, never do any volunteer work in terms of medicine, but you don't have to make that your life. And I think when I was applying, I think that was kind of where they were transitioning to say like, hey, you can be more than just a chemistry major. You can kind of show us your interest and show us that you're involved in medicine while also showing us you're a well-rounded person. So I would say try to do those things.
Yeah, I would agree. I think being a well-rounded individual really enhances your opportunities. And I think the more you can hang around a hospital or healthcare facility as a volunteer or on the side is very helpful. Working with the community, volunteering, health screenings, anything you can do to be out. Because I think the other thing you have to be careful about is, let's say you want to be a doctor, right? And you're going for it this whole time. Then all of a sudden you find out you don't like the sight of blood and you're going to faint and this and that. So obviously you want to be as well prepared, but we are looking at the applicant as a unique individual, and we are looking for some well-roundedness that I would pick a couple things that you do and do it well instead of just joining 20 clubs. Be in a couple really important clubs that are going to help develop you for what you want to do. Definitely, we talked about the shadowing in a lot of different types of professions and disciplines to get a good idea for what's going to be really a good fit for you. And then anytime you can get involved with any community screenings, though, and public health type of work, I think would be good. So yeah, so it's kind of whatever's going to make you a well-rounded person. But the bottom line is we want to have a passion for everything we do. And that's really what we want to do is develop a passion and make sure you're going into the right kind of profession, because you definitely have to be able to listen to complaints. You know, we have students saying, oh, this is getting tiring hearing all these complaints every day. And go, well, you know, that's what medicine's about. They have to complain and you have to focus and help them deal with that complaint. So yeah, so I think it's important to be a total package when you apply. That's what we're looking for. We're looking for people that just don't have a high GPA or did good on the MCATs or whatever. We're looking for people who are going to be a good fit, not only for our schools, but our profession. Yeah.
Yeah, I really, really like that. Someone asked in the chat, I think a little bit more sports medicine as well. Do you get free tickets to the professional game if you're part of the, you're the doctor for the game?
Well, I could just answer this a little bit. I work as an EMT for special events for a rock medicine organization. You don't just get a free ticket to show up and watch. You're actually showing up to work. You have clinical responsibilities. And I could also tell you that you just can't show up and sit and work on Steph Curry's ankle or anything like that. It's just not going to happen. But yes, if you either volunteer or work for an organization, you know, as an ER doctor, EMT, whatever. But I'll let Dr. Dutra, who's more of the sports medicine person. But yeah.
Yeah. I think, and those are good points. I think it definitely depends on the level you're talking about. So as far as in the collegiate ballpark, yes, you get tickets to all the games. You can go to all kinds of things, bring your family, all that. But obviously, if you're working it, you are available to work. And depending if you're on the sideline or if you're in the crowd, so it's going to depend. But yes, there are opportunities. However, we're way too busy to go to a lot of the games anyway, because remember, we have another job on the side, you know, our main job, and this is more of a consultant thing on the side. So again, we try to be available. But it is nice. The reason I like going to the games is I like to see the athletes I've worked on and make sure they're doing well. And it's nice when I see them in clinic that I can say, oh yeah, I enjoy watching you play your sport and all that. So, but yes, that's definitely, it's not something you're just going to go there as a guest and then start treating people. It's definitely something on the side, as long as everything's being covered. So hopefully that's kind of in a nutshell.
Yes, thank you so much. And then in these last few minutes, I want to ask each of you, because I see you all as very successful people, but what is your own personal definition of success? I guess we can start with Dr. Ivanova.
Of course, I'm going to go first. That's a really difficult to answer question. That's really difficult to answer. I mean, I think everybody has their own priorities in life and what success means to them. I think for me, it just means to have a really good balance where I'm not, again, defined by my career. I'm not just stressing over what, you know, my patients and things like that, that I have a life outside and I'm able to dictate how much of my day I'm going to be spending to my work. And I think that having that freedom can be really difficult. But yeah, I think that's what it means, is to have balance.
I love that. Dr. Lister?
So I'm going to piggyback on that. I think if you'd ask a lot of podiatrists what made them go into podiatry, I think a lot of it is, you know, you have the ability to go into multiple realms of podiatry, but also the work-life balance, right? Like for me, again, like, you know, we go through different seasons in life, right? So like right now, like, again, I have a wife, I have a child. I want to be home, right? Like I want to take care of my patients. I want to be efficient. And, you know, right now I work 4 days a week. I have Mondays off and I spend all Monday with my daughter and it's great, right? Like if I weren't able to do that, for me in this season right now, I don't feel like I would feel successful, right? But when she starts school and she's busy, I'll probably start working 5 days again, right? Like I think it's just about making sure like you know what it is you're looking for and really kind of going for it. And I think that's kind of what has always been my like compass, right? Like just making sure that I know what I'm looking for, and as I change and as my career changes, it's always evolving with me. And again, knowing that I'm more than a podiatrist. Like my daughter doesn't care that I'm a podiatrist. My family still looks at me the exact same. My brother's still my older brother, right? Like, so I think that's kind of how I define my success in this realm.
I love that. And Dr. Dutra?
Yeah, those are good points. I think it's success is measured on a personal basis, and I think it's your satisfaction with what you've done. I think, have you been passionate your whole career? Have you made a difference? And it's pretty simple. I tell the students, being in practice was pretty simple. You focus on your patients, and then you're probably going to be very successful. And much like teaching, we focus on our students, and so you're hoping that our students will be successful. So it's interesting because success, even though it's a private matter as far as who's assessing how successful you are, we take pride in making sure all our students and residents are successful. So it's kind of like a big fellowship thing out there too. So I think success ultimately is measured by our patients. Our patients are the ones who will tell you how successful you are. They get it. So I think if we're passionate, we care, we have empathy, sympathy, we're good listeners, we deal with it all, So again, hopefully everyone will be successful.
Great. I think that's a great place to end. Thank you so much to all three of you for taking the time to answer all these questions from the people that attended today. I really appreciate you spending your weekend with us.
Thank you.